Good evening, friends. I hope all of you are doing very well. A few days back, one of the internee in our hospital asked me a question. Sir, majority of the patients you are prescribing lycopodium, sulfur. She told, so since 2 to 3 days, I saw to many of the patients you have prescribed lycopodium. Some patients are bald head. Some patients, though they have very good hair, still you have prescribed lycopodium. Some of the lycopodium patients, they were tall, some were around just 5 feet height, some were lean, some were fat, some were angry people, some were fearful people. You are prescribing almost everybody lycopodium, sulfur, pulsatilla, or phosphorus, few of the drugs. And you are frequently prescribing lycopodium in our clinical practice. Sir, are you prejudiced? She asked. Or else is lycopodium your favorite remedy? Now I have an answer for her question. Majority of the senior homeopaths are well aware about this. In our practice, what happens? 10 patients cured with sulfur as constitutional remedy, or 10 patients cured with lycopodium. We have prescribed lycopodium as constitutional remedy. They are not exactly alike. Even what I have frequently seen is, even the remedy like carcinogen, 10 patients, we take case in detail. We analyze the symptoms into common and uncommon. We make totality. We repertorize the case very well. And we go from patient to drug to the 10 patients whom I have prescribed carcinogen as a constitutional remedy. All of them they are not exactly alike. This is called shades of remedy. This is called shades of remedy. This is also called as facets of the remedy. See what happens? We will have a very fixed idea about drug. Say for example, how is sulfur patient? Oh, sulfur patient is lean, thin, stooped shoulder. Yes, in our clinical practice, if you see a patient who is lean, thin, dirty skin, or who has aversion to bath, lean, thin, stoop shoulder, sulfur definitely works. But this is one of the shade of sulfur. I prescribed many people who are a little bit obese. They are also sulfur. Those sulfurs were, whenever they came and sit in front of me, they were sitting with bending backward. Okay, voice was loud. We have rubric voice loud. Nearly nine remedies are there in synthesis and complete repertory. Sulfur is one of the drug. Sitting with bending backward means they're haughty people. Okay, somebody is very creative, intelligent, but not lazy, yet they are sulfur. Some sulfurs, they're a little bit timid. They look like lycopodium. Some sulfurs are more friendly. They look like phosphorus. Some sulfurs, they're very artistic. They look like carcinogen. Some sulfurs, they're a little bit mild, emotional. They may look like pulsatilla. Even lycopodium, as all of you know very well, lycopodium is a spore. It is prepared from the spore. The spore is crushed. The crushed spore, we prepare the medicine from the crushed spore. Lycopodium spore contains sulfur, potassium, calcium, phosphorus, silica, and many other minerals. As all of you know very well, medicine prepared from plants by default cover many minerals. Here, lycopodium is very rich in sulfur, calcium, potassium, even phosphorus and silica. Majority of the time, we say lycopodium as vegetable sulfur. I have seen some of the lycopodium patients, they're a little bit casual, friendly, relaxed, they're haughty, but they like hot food, they're very intelligent. Few lycopodium patients, they look like sulfur. Few leukopodium patients, they are more quarrelsome. They are more anxious. They have a lot of anxiety. They look like calicar. Few leukopodium patients, it has calcium, no? It also looks like because they're esteemed, they cannot tolerate, contradiction. They have a little bit mild hatred for who contradict. It also looks like calcareous self. Some of the lycopodium patients, they look like carcinogen because they are very yielding, very well behaved. They have a lot of anxiety, anticipation. They have a lot of fears, very obedient with the teachers, obedient with the elders or with the boss. They have a lot of stage fear. They may look like carcinogen. So like this, in our practice, majority of the time, the polycystic remedies, we see shades. The question is, why do we see these shades? The answer to this question lies in understanding the drug proving. We should know very well the drug proving. Okay. See the basics, what we study in our first year BHMS, that is construction of homeopathic metamedica, how drugs were proved. If you understand that point very well, you can get answer for this. Because theory and practice is not different, dear friends. To get solve all your doubts in practice, you need to have a very good knowledge of theory. And then when drugs were proved on healthy human beings, when metamedica was constructed, according to Hahnemann, in the later stage, what he used to do, he used to take 3 to 4 pills of lycopodium 30 or sulfur 30 or pulsatilla, whatever the drug. He used to dissolve 3 to 4 small pills, pupicate pills, which were already charged with the dilutions. Those pills he used to dissolve in 1 or 2 tablespoons of water. He used to administer in the empty stomach in the early morning for drug proving on healthy human beings. And after 24 hours, he used to collect the symptoms from the provers. What Hahnemann mentions, within 24 hours, if somebody mentions any abnormal signs and symptoms, any deviations, to those subjects, Hahnemann calls it as single dose provers. Those provers who did not produce symptoms, Hahnemann gives second dose, third dose, fourth dose. Like this, everybody produces a symptom. Hahnemann mentions medicines act unconditionally. Okay, so if you go on proving this drugs, all provers will produce the symptoms, either to 5th dose, 6th dose, or 7th dose. Okay, but the scenario is what he tells, to the same drug, everybody will not react. Suppose, for example, I would like to prove sulfur. Okay, prover number 1 produces few mental symptoms or few physical symptoms. Prover number 2 produces few mentals, few physicals. Prover number 3, few mentals, few physicals. Prover number 4, few mentals, few physicals. Okay, they may produce symptoms. One may produce symptoms to a single dose, one may produce symptoms to the second dose or third dose. Hahnemann mentions there is wide variation in revelation of the symptoms to the same drug when we prove on healthy human beings. This is because of difference in their peculiar corporeal disposition of the provers. Some of the provers are fat, some of the provers are lean thin, some of the provers are quick, some of the provers are sluggish. See what happens when drugs are proved on healthy human beings, everybody will not produce every symptom. What Hahnemann has mentioned, what Hahnemann has observed was, say for example, like Naxomica 30, if he proves on healthy human beings, people who are lean thin, dark complexioned, who are basically of choleric temperament, angry people, who are quick people, they're easily affected by proving of single or less dose of Naxomica. The same Naxomica 30, if you give to the who are fair, fat, flabby, sluggish people, they may require more doses to prove the symptoms. Say, for example, if you want to prove calcarea 30 on healthy human beings, people who are slow, sluggish, obese people, or who are fearful people, who are easily affected by calcarea carb, they easily responded to the calcarea carb. They produce the symptoms to calcarea carb. So, like this, what Hahnemann was observing was to the same drug, everybody, all the provers do not react in the same way. Even among the single dose provers to a particular drug, everybody will not produce every symptom. That means there was a concept of constitution, there was a concept of individual variations, there was a concept of shades in the very process of proving drugs on healthy human beings. The drug, when drug is proved on sulfur, lycopodium, pulsatilla, when drug is proved on different provers, all provers did not produce all symptom. Prover number 1, few symptoms. Prover number 2, few symptoms. Prover number 3, few symptoms. All these, like this, all the symptoms were collected. All the symptoms are again segregated and put into under the scheme of mental symptoms, vertigo, head, into anatomical schema. Suppose in the mental section, if you see a group of symptoms under sulfur, mind you, all those symptoms were not produced by single prover. They were produced by different provers. If you go under the head, what kind of symptoms you see in Materia Medica Pura or Theory of Chronic Disease or Alliance Encyclopedia, mind you, all these symptoms were not proved on single prover. These were different provers, different symptoms, all were collected and put into the anatomical order or schematic anatomical schema. So, what I would like to convey you is always go from patient, take the case well, try to understand the picture of the patient very well. In that, try to extract the grand peculiar symptom, qualified mentals, qualified physicals, grand outstanding peculiar symptoms. A group of symptoms, you make totality. Go from patient to drug, not from drug to patient. Getting my point? Suppose a patient who is very casual, speaks with bending backward, haughty, loud voice, creative person, boaster, likes sweets, and very friendly, lies on left side. All these rubrics, if you take, sulfur will come. Another person, very lazy, slow, sluggish, okay, aversion to bath, very dirty person, not good at studies, not creative, okay, lack of memory. Yet, all if you go from patient to drug, yet we can prescribe sulfur. Like this, go from always patient to drug without having any kind of prejudiced picture about the drugs. When I spoke to many senior homeopaths, they always advised to me, like Dr. S.K. Tiwari sir, Dr. Ajit Kulkarni sir, many senior homeopaths, Dr. Kishore Mehta sir, they always advised me and many of my friends that we should always go from patient to drug. So there can be many shades of polycrest remedies. For some of the intermediate students, it may appear, oh, sir is giving sulfur lycopodium. We also know sulfur lycopodium. You read in the book. But to take case thoroughly, after evaluation of symptom, after choosing right rubrics, to come exactly, precisely to one drug is difficult. This art we need to learn. I hope the points what I would like, what I wanted to convey, you have grasped the points very well. I hope, I wish you one and all a very happy learning experience. If you like my video, if you like my videos, kindly press like button and share the videos with your friends. Thank you one and all.